afternoon, everyone. Welcome to Working with Glaucoma, Helpful Strategies and Low Vision Resources. My name is Michelle Delizalde, and I am the Event Program Manager at Glaucoma Research Foundation. I'd like to take a moment to thank Aerie Pharmaceuticals for their sponsorship of our webinar series and their continued support of glaucoma patients everywhere. Today, I'd like to introduce Dr. Tracy Machinsky. She graduated from the Illinois College of Optometry and completed her vision rehabilitation residency at the William Feinblum Low Vision Rehabilitation Center of Pennsylvania College of Optometry. Since then, she practices at the Chicago Lighthouse for the Blind and the Illinois College of Optometry. Dr. Machinsky is a dedicated doctor and educator who still finds time at local and international clinics. After her presentation, we are going to have a Q&A where we will be joined by 3 glaucoma patients, Amanda Eddy, Charlotte Lewis, and Richie Kahn, and they will be sharing their experience in the professional world. It is my honor to welcome Dr. Machinsky.
I would like to thank you for having me, and I think it'll be a pleasure to talk with everyone this afternoon. And I'm going to do just an overview of what we do within the realm of vision rehabilitation. There's just so much information out there that you're finding that when you have glaucoma, not only do you need sometimes the regular eye doctor, but you also need your glaucoma doctor. And sometimes you might need a vision rehabilitation, or commonly referred to as a low vision doctor as well. And that's where someone like myself would come in. So I thought it would be good, because it's my area, I'm just going to do an overview of what we think about when we're working with people that have glaucoma and how we try to assist them. So there are many clinical tools that really help doctors treat and manage glaucoma. So there's a lot of clinical data that comes as pictured here that we look at quite a bit when we're trying to decide what eye drops do you need. Did you need a laser procedure or something else? And this is all good information, and it's something that a vision rehabilitation doctor will definitely take a look at, but we're a little bit more concerned about what your function is. And that's what you can expect when you come to a vision rehabilitation examination. So I thought I would talk just a little bit about how glaucoma might affect your vision first. And my apologies in advance if you have difficulty because of your vision seeing the slides, but I do have some photos. This photo is from the National Eye Institute, and it tries to simulate what happens when you lose your vision from glaucoma. And it's the classic, we have tunnel vision. So the picture just has a central couple of degrees available. But if you work at all with this, with people with glaucoma, or if you read any of the research, here's just a few of the references. What do people, and I'm preaching to the choir here, what do you experience when you have glaucoma? What kind of visual symptoms do you have? And, I have some of them written here: blurry vision, lots of problems with glare. You start to second guess yourself, taking care of yourself or doing your activities of daily living. Sometimes there's some problems with independent travel, especially outside of your normal environment or outdoors. You have troubles when you go from light to dark or dark to light. If there's a crowded visual scene, you might have trouble processing some of that. And sometimes driving or other quick eye movements are disrupted as well. So I happen to work at the Illinois Eye Institute in Chicago, and we have a very high population of people, unfortunately, that have vision loss from glaucoma. So I probably see vision loss from glaucoma maybe more than the typical low vision provider. And I just kind of keep track of what the symptoms that I hear. In addition to the previous slide, people and you guys know this, you often say that, my vision just isn't as clear or as crisp as I would like. Things look a little bit hazy sometimes. Glare bothers me. I do have trouble going from light to dark or dark to light. Things look a little bit faded. So those are very common things that we hear. I don't often hear, I'm having trouble with my side vision. We hear it, but not the number one complaint. So talking about visual field just for a minute or two, because that, as you're treating glaucoma, that is something that you try really hard to maintain the visual field. And people with loss of visual field don't just, you guys know, you don't have like a black spot in your vision necessarily, it just kind of grays out. So the public health initiatives are often like, if you're losing your side vision, get treatment for glaucoma. But when you're losing your side vision, the glaucoma is advanced already, and we certainly want to try to stop it before it gets that far. This is a slide that I think is very interesting of a particular study that looked at that classic tunnel vision complaint, and it asked people with moderately advanced glaucoma, what is the problem that you see? And no one said they saw tunnel vision. So the people were presented with a picture and asked what it would match like to whether it was a blurry tunnel. They have black parts, like missing chunks of it. Blurry parts are just, they don't see, but there is missing parts. And to the right on the slide talks about who answered what. And mostly they said it was blurry or missing. And those are the bottom two images. So we don't see in the bottom two images like this tunnel vision that everybody talks about, rather that glaucoma affects your visual abilities or visual field, that you might miss certain details or they'll be blurry. So those are the kind of things that we're trying to help our patients with. And again, talking about who should be treated or watch for glaucoma, hopefully, getting away from that tunnel vision would be important, because that's not the primary symptom, unfortunately. So going to the publications or the research within glaucoma, there's a lot of information out there, and there's a lot of measurement tools, validated research tools that try to ask people with glaucoma what they're having trouble with. And just to paraphrase this slide, people with more advanced glaucoma, the more advanced it gets, the more symptoms pop up, but they also have lower physical activity. Increased depression, they have a fear of falling, they spend less time with vigorous physical activity, lower steps per day, and they read less, and they have problems with visual crowding. So again, all of you probably are thinking, yeah, that applies to me, maybe with one of these symptoms. So those are the things that within a vision rehabilitation exam, we try to help people with. So these are just some of the specific tools that are used to assess what the glaucoma does for someone, how it affects their life. And you all know, as a glaucoma patient, you're going to your glaucoma doctor all the time. And it's an unfortunate necessity, because it helps us as glaucoma doctors to treat and manage your condition and make sure you don't have vision loss. But what happens, because you're going to your doctor so much, we often forget that we have to step back and do a nice full general checkup, prescribe glasses, look at contrast. So a lot of the patients I'll get from the glaucoma clinic have tape on their glasses, because the glasses are 5 or 6 years old, because even though you've been going to the doctor, you haven't stepped back and had that general exam, or even better, a vision rehabilitation exam. So that's something you always want to make sure, not only are you seeing the glaucoma doctor, but you're getting regular primary care as well. So I think I'd like to talk a little bit, what do we do in a vision rehabilitation exam? So if you haven't had one, it will help you to know what to expect. And if you have had one to know what additional things that maybe you can ask your doctors for. So what we do when we come within the vision rehabilitation exam is we try to take a history or talking to you, what are the problems that you're having within your day-to-day life, whether you go to school, whether you're working, whether you're retired, what kind of lighting or magnification you might use, and what kind of maybe transportation services that we should think about. Other things that we try to look at within these examinations are looking at assistive technology to help you. There's also concerns, as with any patient, about mental health. So there's a couple tools we might use to assess a person's anxiety or depression associated with the vision loss or the condition. We often try to work in a team, referring to other rehabilitation professionals that can help a person live their best life, even with vision loss, and helping with support referrals such as the Glaucoma Research Foundation. So low vision or vision rehabilitation is an assessment that tries to make the most of your vision and make sure you have the best resources. And it is a standard of care in people that do have vision loss, whatever the reason. And what we do know is that the vision rehabilitation is most successful when there is a team approach. So it's not just the eye doctor. It might be a psychologist, a social worker, an orientation and mobility instructor. But part of the vision rehabilitation process is to help you, expose you and create that team of vision rehabilitation professionals to help you in whatever avenues you need help with. So what happens during a low vision exam or vision rehab? Again, we ask a lot more questions about the functionality of your day-to-day life and try to figure out exactly where you're having trouble. We do a careful refraction, and not typically behind that big metal thing called a phoropter. Rather, we put a trial frame on you, which is a little bit easier for you to take a look through and take your time to see what lenses are the best. In addition, when we assess vision, we're not just looking at the eye chart in terms of, what do you see 20/20? Do you see 2100? So in addition to acuity, we also look at things like color vision or importantly, contrast sensitivity. How much can you focus? What is your functional visual field? Things like this. After we understand more about your vision, then we think about what kind of magnification you need, meaning making things bigger so they're easier to see, whether it's up close or far away. We take a look at assistive technology, non-optical products such as big button telephones, high contrast cutting boards. I'll have a few pictures on those. And we think about what are all the things that you need to create a most successful outcome. So we develop those in what's called an individual rehabilitation plan. So thinking about what other team members, what other rehab professionals we need to work with. And then, of course, the referrals and so forth. So a word about the mental health. When you're dealing with a chronic condition, everyone here, I'm sure, can attest to the fact that there's good and bad days, but there's certainly a lot of stress surrounding the vision loss or how you're able to live your life. So it is something that we want to take a careful look at in a vision rehabilitation examination and make sure people have the best and proper resources to help them. In terms of visual acuity, we often, look at that eye chart and write down 20/20, 20 whatever. When you get to a vision rehabilitation examination, you're going to find that there's different charts sometimes that we use, and we might bring them closer to make them easier for you to see. When we're testing your near vision, which is critical to looking at your phone, looking at a computer, any kind of reading, when we test your near vision in these type of exams, we try to make it what's called continuous text. Magazine, newspaper, we want to get more of a reading acuity so that we can translate that into something that will help you. And this is a picture of a trial frame refraction. So it's actually a sophisticated little frame we put on with lots of little controls on it, so we can put the lenses in there to help you to see your best, and then again give you a little bit more natural viewing ability to make sure it's the best lens for you. And I mentioned earlier, we look at additional visual functions, especially contrast sensitivity, glare control, and so forth. So we try to collect a lot of data about how your vision is. And I'll just say contrast sensitivity is an important point of your vision that can help you be better with mobility, can help you recognize faces better, look at faded print. And we know, unfortunately, with glaucoma, it is one of those things that is degraded and makes that quality of your vision harder. It's not, like I said, as crisp or as clear as we'd like it. And that's because the contrast is reduced. And we try to do things within the vision rehabilitation exam to help with the contrast sensitivity loss. In terms of your side vision, your glaucoma doctor always does the test where the lights flash and you have to click a button. In a low vision exam, we use this type of test, and it's slightly different, and it measures your farther peripheral field so we can get a better sense of what your mobility is. Should you still be driving? Do you need a referral for orientation and mobility? Do we need to explore alternate travel options? So the picture on the left is the the functional field that we might measure. On the right, drawn within the black circles, is a field that you normally test glaucoma for. And when you normally are testing glaucoma, it's always the central field. And you can see I can fit a lot of those within your actual side vision tests that a low vision doctor might use. So on the top, you as a patient probably have seen this with your doctor, and the dark spots, unfortunately, are where glaucoma are causing a problem. If we look down on the functional field along the bottom, what your low vision doctor looks at, even though we have all those dark spots, we still have a lot of remaining vision that we want to access and use successfully. So again, we're trying to combine information from your glaucoma doctor with the additional testing that the low vision doctor does so that we can provide the best information for you and create the best solutions. So once we take a careful collection of all of the data and look at what your glaucoma doctor thinks, then we start to prescribe devices before the service referrals. So the devices, I'm just going to walk through the major categories that we use. And the first type of device might be something called a microscope, and that's basically any kind of magnification that's provided within the glasses. And it could just be a regular bifocal. It could be a special pair of reading glasses. And the thing to know about the reading glasses or microscopes, the stronger the power, the closer you'll have to hold things to keep them in focus. And microscopes work really well, and they work even better if you have an appropriate light, which I'll talk about in just a minute. Another category of devices, another category would be handheld magnifiers. So if you need a certain level of magnification, but you don't tolerate it well in glasses, we have other options for you. One being a magnifier, which maybe a lot of you are familiar with. It's just a handheld lens, typically with a light on it. Another device would be called a stand magnifier. Again, it's just a magnifying lens that sits on the paper so you don't have to hold it up, and it's a little easier to use. And with all of these devices, we for sure want to make sure that a light is attached. And then there's something called electronic magnification. So it's a video or digital camera that enlarges whatever you're looking at onto a screen. It could be print. It could be something, if the camera rotates, it could look at distance. It could look at you in one of these pictures. This is my occupational therapist. She's actually doing a little self-care. So it provides magnification onto a screen. To switch gears a little bit and talk about your distance vision, we have telescopes. So telescopes are something that will magnify your distance vision. And you can see in the picture here, we have a couple people wearing the telescope glasses. So there's a lot of different options for prescribing those. This slide just shows ones that clip onto your glasses, and ones that you can walk around in and you would tilt your head down to spot through the telescope. So there's lots of different options with all of these devices. Moving on to another category is contrast and glare. So those are two different topics: contrast, decreased contrast, unfortunately, with glaucoma, but also increased glare. And really, some of the best ways we can help with that is to use different colored lenses. And you can see here is just one brand that we use called Cocoons. And they're a little bigger and bulkier, but what happens is they literally kind of almost rest against your forehead and your cheeks. So they really do like almost cocoon your eyes. So all that extra light that comes in doesn't bother you. This is another picture just of this kit has almost 50 different colored lenses that we can try with patients. People with glaucoma, and I'd be interested, your comments, people with glaucoma tend to do better with a yellow tint to help enhance the contrast sensitivity loss. Sometimes they might like orange as well. When you go outside and you have glare, then we tend to lean towards polarized filters. And people that have significant glare typically have more than one pair of these fit-over sunglasses or glare shields to help them in different lighting situations. Another very easy way to help yourself is just to wear a visor. Even with the best sunglasses, sometimes just having that physical visor in place when you go outdoors definitely helps. And the idea behind protection from glare is that when you're outside on a sunny day or a brighter day, and if you don't do anything, you come inside and it takes a few extra minutes to kind of let your eyes adapt. However, if you're wearing the right glare control outside and you come inside, then you take off the glare control and you can move much faster. Your eyes are already adapted to the new lighting conditions. So speaking of lighting conditions, here I have pictured a couple of what I would call task lights. So they're very specific. The light is directed down on what you're looking at. It could be a pocket LED flashlight, or it could be a little lamp. And the idea is the light has to be below your eye level. It has to be closer to whatever you're looking at than your eye is. That's when you get the best light that can help you have the print or whatever you're looking at become more visible and more able to read it or do your crafts or whatever. But because of contrast sensitivity loss, it's really important to have the best light. And really the best light comes down to positioning it close as possible to whatever you're trying to read or look at. And then we have a lot of non-optical products. So things that are high contrast, large print, sometimes with some tactile feedback. So these are things that if you came in with the concern that I can't fill out my checkbook or I have trouble in the kitchen, this would become part of the evaluation to make sure that you can do whatever you want to do comfortably. But there's a lot of non-optical products out there to help you. Again, another couple pictures of using non-optical products. The cutting board on the bottom is white on one side and black on the other. So if you're cutting something light, like this orange, you're going to want to use the black side. But say I was cutting a tomato, I might want to use the white side, just again to enhance the contrast. Bump dots, sometimes if it's just too hard to see the dials on your washing machine or your microwave or your stove, we might use bump dots, which are brightly colored and raised so you can tactilely feel them. So these are just some of the solutions we might use with people. And then, of course, the whole realm of assistive technology, which is so critical to all of us these days. And that's an important part of vision rehabilitation. And there's many, many different kinds. I'm going to talk about each briefly. Some will apply to everyone and some will apply to only a few people. It depends on what your needs are. So how do you keep up with all the assistive technology? That's a very good question. So for myself, these are some YouTube channels, especially the top one, the Blind Life gentleman, Sam, has macular dystrophy, but he reviews all the new products. But if you just look on his or any of the other ones, it can just kind of help you talk through, like if you saw this new device or someone said, hey, have you seen IREA? You can be like, I wonder what that is. And one of the places you can look is some of these YouTube channels. They can kind of give you an overview to start your learning process on it. Electronic technology, we talked about a little bit already. It's a camera attached to a screen. And there are some that are head mounted. So this one is called Iris Vision. And it's just a virtual reality headset, but the magnification goes right into the phone. And that's what you're looking at. And it can provide magnification up close and far away, but you can't walk around with it. That's the one downfall of that device. So there's some people that the vision is hard to use and sometimes they'd rather use their ears. So there's something called NVDA or non-visual desktop access, which is just a free screen reader on the computer. Now, computers have lots of options built in for some type of screen reading, like reading what's on the screen instead of visually looking at it. And it also has enlargement or zoom features. But this is just, if someone is really more of a listener, this would be something to explore. Going down the path of not using your eyes so much, there is many Braille resources. Braille is a wonderful thing to learn, but challenging. So, for those who might be thinking about that, that's a great avenue to explore. And I think all I would say is there's a lot of newer technology out that makes that a very viable option. Refreshable Braille, you see there on the screen. As a person goes down their computer screen line by line, the Braille cells pop up with the new print, so you can just read line by line. Again, a lot of computer adaptations are already built into your computer. Just look under the accessibility features. They are sometimes, again, they're always included, but there's sometimes programs that might be a little bit better that can be bought and downloaded. The big ones are Zoom Text and JAWS to help enlarge, change contrast, or be a screen reader. So lots of options out there for the computer. And smartphones. Everybody, I'm sure on this call, has a smartphone. You could reach out and grab it. I mean, that's how dependent we've become on them. So there's a lot of features within a smartphone that can help someone with a vision impairment. And I think the notable apps, two things I always like to show patients is we can use our smartphone like a video magnifier, and we can also use our smartphone to read things through to us. So the Android or Apple products, they all have great features. And on the highlight here, I have some notable apps. Seeing AI on Apple phones is what's called OCR, Optical Character Recognition. So Seeing AI if you have an iPhone, or Envision, Envision, if you have an Android. Those both are amazing apps that can read things to you. They can recognize colors, talk to you about what money there is. It comes in different languages, so download those. Seeing AI is free. Seeing AI is free. Envision is free for a month, and then it's like $15 or $16 for the year. Well worth the money. The other thing always I want people to know is that the apps for magnification, so supervision or brighter, bigger, or simply magnifier, all of those free apps you download, and then you turn your smartphone into a small portable video magnifier. There's many other apps out there, CamFind, TapTapSee, where you can take a picture of something and send it, and then a person at the other end will tell you what you're looking at. So lots of cool things. You can talk to each other or your vision rehabilitation doctor, what apps might be helping me be more independent. And there's things called prosthetic vision or sight substitution. The Argus 2 is an implantable device for people with retinitis pigmentosa, so not glaucoma patients, but we'll see what's down the road for that. OrCam is a device you wear on your glasses that it does OCR, or it reads things to you. IRIA, the third one down, is when you tap on the button, it'll connect you to a live agent, and the live agent sees what you're seeing and can talk you through things, whether it's a mobility issue or a reading issue, et cetera. And that's a subscription service. And then there's something called a brain port that is, it uses a camera, and it's like a little electrical lollipop people put. So when the camera sees like the coffee cup image, the little lollipop, that it's not like a candy lollipop, the sensor will create that shape on the roof of your mouth. So these are, sometimes our friends, our family say to us, why don't you get IRIA or BrainPort? So just to kind of talk about these a little bit in terms of what they are and what you should be exploring. I think of all of them, really the OrCam or IRIA would be appropriate for this population. And then there are canes. I'm not sure how many people use canes. Canes are an amazing thing to help us to be more independent traveling. And smart canes are, the WeWalk is the smart cane out there. It talks to your cell phone and it tells you about obstacles or GPS navigation. So there are some advances in just regular mobility canes. And then things that we use for the general public. So I don't know who uses, a voice activated assistant, like, hey, what time is it, Alexa or Cortana? So all of these things, the smart home situation, like, please set a timer for 10 minutes, I'm baking something, or play me music, or call my granddaughter. So any of these general things that the public uses, we should embrace and use, not only to automate our homes, but to make day-to-day life easier. If you don't have the BARD app on your phone, or if you're not signed up for National Library Service, I would highly recommend it. For people that have access problems accessing print visually, you can sign up for, it's a free service through National Library, and you can get whatever books or magazines, anything, almost anything you want can be downloaded in an audio file for you to listen to at no charge, which is really nice. So it's like Audible for free. And I know I'm going over, thank you for your patience. I just have a couple last slides. It's important also, something that your low vision doctor might touch on with you is the ADA. And this is, as we all know, and Canada has a very similar act. But what it is it prohibits discrimination of people that have impairment or disability from being discriminated against in the public or private places that the public is open to. And basically what this is it's just making sure that whether it's in employment or, your enjoyment activities of going to a play or riding on public transportation, to make sure that you have the right accommodation so that you can embrace and participate in all these activities like everybody else. And something that the ADA is it doesn't consider, like if you use a cane to travel, it doesn't consider that. It just knows the ADA recognizes that you have an impairment for traveling. And so what happens, there was an update in 2009, which made it a lot more user-friendly. But what happens with the vision rehabilitation doctors, we talk to you about, whether you're in school or you're working or retired, are there things that you are struggling with because you can't access them? And what we do is we try to create documentation for you so that you can go to your HR or your teacher or, the local community center to make sure you have the right accessibility or the changes that you need to be able to enjoy and embrace and do everything that everybody else can do. So a lot of the things that sometimes we might recommend are assistive technology, special lighting or furniture. Sometimes if you decide, yes, I want to go get mobility and maybe a dog guide and I need time away from work, that's definitely covered under ADA. If you need a sighted reader or special devices for recording, or when you're working and they ask you to go someplace, but you're not a driver, that they should provide a driver and sighted assistance during official travel. So there's many different things. And again, it's very unique to whatever concerns that you're having. So again, thank you. And I'd like to thank you for your attention.
Thank you, Tracy. That was amazing, such helpful information, not only for the attendees, but for myself too. I learned a lot. And as I mentioned previously, we will now be joined by Amanda, Charnette, and Richie. Welcome. I would love it if the three of you could spend a couple minutes each telling us what type of glaucoma you have, what you do for a living, and any challenges that you've had to overcome in your profession. I will kick it off with Amanda.
Well, hi, my name is Amanda Eddy. I'm a small business owner in Austin, Texas. I am a jewelry designer, and I have a store and a team of 5 women who help me make and ship my designs. I have congenital glaucoma, so I was born with glaucoma, and I'm 41, so I've had it my whole life. And there's been a lot of things in my business that I've had to alter to make sure I can still do my job well, which I'm happy to talk about whenever we get to that point. So thanks so much for having me.
Thank you, Amanda, which I must say, her jewelry is amazing. Richie, please tell us your experience.
Thanks, Michelle. And I should suggest we should put a link to Amanda's jewelry in the chat because I second it is wonderful. My wife has a couple pieces she loves. Thanks again for the invitation. Great to be here with you all today. My name is Richie Kahn. I work in clinical research of all things. Found out I was losing my eyesight due to a rare form of optic atrophy when I was actually working in ophthalmology. Couple things have changed since then. Number one, I was able to move into a role where I didn't have to travel as much for work. I was looking forward to that even before I started losing my vision. Other thing that's happened is I've developed a bit of a professional focus on accessibility tools. So having lots of conversations with coworkers about how to make the things we do more accessible for all. And looking forward to the conversation today. Thank you.
And lastly, Charnette, welcome.
Thank you, Michelle. My name is Shauna Lewis. I retired. It'll be almost 3 years. I can't believe that. And I worked at New York Life Insurance Company for 36 and a half years. I found out almost about 10 years ago that I have narrow angle glaucoma, which means that your eyes, as opposed to being oval, mine are more compressed. So the fluid does not flow out of my eyes more efficiently. So it builds up the pressure from the water, which causes a lot of eye loss in my sight and damage to the optic nerve. So I have low vision, and I will discuss how I'm dealing with that now.
Thank you all for joining us. The information you're going to be providing is going to be very helpful for everyone. I will kick it off with, I think, an important topic. How maybe any of you can share your experience, how this happened with you, or also Tracy can let us know, give us advice for any of the attendees how they should go about doing this. But the question is, how do I tell my employer? How and when do I tell my employer? And if it will impact my job? And Tracy did touch upon this with the Americans Active with Disabilities, but that specific conversation, what should people say, and how should they ask for all these resources that they might need to be able to continue their work? I will leave it up to you, whoever wants to go first. But I think Charnette wants to.
Yeah, but that is an appropriate question, because working at New York Life, and I'm very avid, very active. And so when I found out I had the now glaucoma and lost a large amount of my sight, I was looking at my monitor in my office, just like I'm looking at you now. And my IT person, who's a dear friend of mine at New York Life, walked past, my door was open, and he looked, he says, "What's going on?" Because I hadn't really revealed the whole thing in story to everyone. And then I told him about that. Do you know, 2 days later, he had these 2 jumbo monitors in my office when I came in, had me come in, we adjusted the fonts and the colors, and we went through it. And that made it really accessible for me to do my job. And it's important that you state to let your employees know when should you. I think it's really important to do it immediately, because for safety issues as well. Because in our environment, we do a lot of fire emergency training. And with my low vision now, if I go into a dark area, it's hard for me to see. So we set up a security thing. If there's an emergency, my immediate people around me will come into my office if there's an emergency, to make sure I can get down the stairs efficiently and without harming myself. So you have to let people know for your own safety as well. So that's what I've learned in my 10 years of having glaucoma, that you have to let people know. Don't be afraid to ask for help and to ask for assistance.
Thank you, Charnette. That is extremely helpful and very important, like you said, for your own safety. I think you should share it. Amanda, Richie, do you want to share your experience if and when you shared with your employers? Well, Amanda, you're owner, so kind of share it with yourself, but maybe when you're sharing it with your employees.
Yeah, I did share that with my employees, and I thought it was really helpful. I have a great team, and they know when there's certain pieces of jewelry that are just a little too small or too detailed for me to work on, and they help me with that. And just being open and honest and sharing that information is helpful.
Yeah, thanks, Amanda. For me, quite honestly, I had a conversation with a labor and employment attorney here in North Carolina to get advice. The way he explained it to me, and I would recommend anyone who has questions to consult a professional instead of me. This is not legal advice, just to be clear. He said, look, it's all about putting your employer on notice, just letting them know you've got a medical condition. You don't feel like it's going to interfere with your ability to do what you need to do. You know, if you need accommodations, you can ask for them. If you don't need accommodations, you'll let them know in the future. But my whole thing, I let everybody in my life know about my vision loss, whether I had conversations with people individually or they just heard about it through a webinar or a podcast or something else. Everyone pretty well knew. I definitely had a conversation with my CEO at the time, let her know exactly what was going on. And more often than not, when I have these conversations, the first thing people say to me is, what can I do to help? Is there anything you need? So very positive experiences overall.
Thank you. And that's important to share, because if you've all had positive experiences and if there's anyone that's afraid to share their current situation, you shouldn't be. You should stand up for yourself and talk to your employers and your coworkers about your situation. However, there might be situations where someone feels that they might be perceived as being incompetent because of their disability. Maybe you have felt this in some situations, maybe not, but do any of you have any recommendations or advice for anyone that might feel that way and how they can go about it?
Michelle, I can kick that off. When I was working at New York Life, I was one of the leads person, and we had our human resources and an ENABLE group, ENABLE, ENABLE, which gives awareness to people with disabilities. So we would have seminars monthly, developing our companies and individuals and giving them awareness about disabilities, not just visible disabilities where you can see someone that needs a prosthesis or something that's visible, but invisible disabilities such as myself, where you may not know I have a disability until I tell you. So we brought disability awareness, and whether it's a mental disability or a physical disability. So ENABLE has helped me to advocate for disabilities and to get the word out and to help companies know that they have a resource where they can engage people with disabilities to help them, whether they need a ramp, whether they need to widen their bathrooms for people who are wheelchair accessibility users, to make sure they have a ramp for individuals to come into the building, to make sure if someone has a wheelchair device that they're on the first level or level where they can get immediate access in the event of an emergency to get out the building. So those are things that we advocated for.
Thank you. I do have a question about glaucoma and driving. So maybe Tracy can explain a little about this, some devices that might be helpful for people because they have difficulties with peripheral vision and depth of perception, and also going into different lighting conditions, maybe bright sun to fog or all of a sudden nighttime. What should people do in these situations?
So it's a very delicate and good question. Independent mobility is a big deal. And unfortunately, one of the things about glaucoma is sometimes that takes it away. You know, the first steps when we want to address that is first we have to look at, do we meet the requirements to have a driver's license in whatever state you reside in? And that is really only visual field and visual acuity. That's it. It doesn't talk about adaptation to glare or contrast or depth perception. So, you know, step one is whether or not you even qualify. Step two is we do look at those things and we talk about those are really the factors that can make you a safe driver or not. And we have to step back and say to ourselves, is it, you know, if I'm not comfortable driving, should I be driving? So that's a difficult conversation because even if you meet the requirements, it doesn't always mean you should be a driver. So if you meet the requirements and definitely have a desire to drive, sometimes then we look at driver rehabilitation where you could have a driver assessment. It's typically computer-based and then behind the wheel to see if with your visual challenge is, would you be a safe driver? And then the driver rehabilitation specialist behind the wheel with you can give you some good advice. So there's not a simple answer to that. It's certainly several steps you have to go through, but I think, a foundation like this, or your doctors, or your peers can start talking to you about, when is the time to drive? When is the time to stop driving? And some of the things that even if a person should be driving, they're not really that good of a candidate. And we try to make sure they have other resources such as public transportation, ride sharing, et cetera. But that's a tricky question.
I understand each person and each case is different. But it's good to know different situations and what is available out there. Richie, did you have a comment?
Yeah, just to add to that, Michelle, for me, I was very much concerned with my ability to drive, specifically concerned whether or not I would be a danger to others on the road. So I had a very frank conversation with my eye doctor. And I said to her, look, I am going to rely on you to tell me when it's safe and when it's not safe. And eventually came to the mutual decision that it probably wasn't a good idea for me to drive anymore. But just having that conversation, I think if we hadn't had that discussion, she probably never would have told me. But when I made it clear it was important, she said, okay, well, let's look at the things that are beyond the exams. Let's talk about functional vision. If you're experiencing X, Y, and Z and you're too hesitant, it's probably not a good idea to be behind the wheel anymore. So that's what we did.
That is, sorry, Shauna, go ahead.
I have a joke about that as well, as what Richie said, but mine wasn't with my doctor. It was with my sister, who was an RN, because I drove everywhere. I was an independent person. And I just knew after I had my third eye surgery, oh, I'll be able to drive, And my sister said, oh, no, you won't either. And she stated, you will not be driving. And she sat down and she said to me, you're not only putting yourself in danger, like Richie said, you can put others in danger. And that was an eye opener for me as well.
That is very true. That is very true. So please, everyone, remember, it's not just about you, it's about others. And don't be afraid to have this conversation with your doctor to let them know when is the moment, when should you stop driving? Another question that we got is where you can get these low vision aids. I'm sure it can be in multiple places, but also, do you need to have a prescription from your doctor to get these vision aids? I know the apps in your phone, no, but some of the devices themselves. Tracy, could you help us with that?
Sure. I think the best place to start is just with your glaucoma doctor. Say, I think a good vision rehabilitation exam is a good place to start. You can buy anything on the internet and you can do research and take a look and spend money and probably do pretty good most of the time, but nothing replaces a little bit of, this is specific to you. This is what you need. So I would, of course, always recommend just get connected with a doctor who can do vision rehabilitation, and your treating glaucoma doctor should absolutely know who to send you to in the area. And then, you're going to get a list of things that would be helpful. Some you can get on your own through the internet. Some are prescription only through a doctor's office. Some of the most spectacular exams I have are just, I have my phone, the patient has their phone, and we just download a bunch of apps and I do some training. And then if I still need more training, I might have my occupational therapist follow up with the person. So that would be the ideal way to go. It would just save a bit of frustration and anxiety, sometimes not knowing what might be right for me or what's not right for me. So I would, try that. And then, you see your low vision doctor as needed. The glaucoma doctor, you see them all the time, but I might see someone and then I might not see them for 2 or 3 years because they're doing really well. And then they have a new need, and then they understand what the vision rehab doctor does, and they can touch base with whether it's driving questions or ADA, et cetera.
Thank you, Tracy. And kind of leading up to this question is also, when should someone consult a low vision specialist? I know people just go to your optometrist or your ophthalmologist, and you don't really realize that this is available to you. Or some people might be recommended to see a low vision specialist once they've lost their vision and it's too late. And so one should probably go earlier on. What do you recommend, Tracy?
So I would say as soon as you're starting to have functional problems, be an advocate for yourself and, put your doctor on the spot saying, I can't read my phone anymore. What can we do about it? And your glaucoma doctor hopefully will say, why don't you go see Dr. Low Vision down the street, or Dr. Vision Rehab, someone who knows a little better and can take the time. In the glaucoma office, you might get 15 minutes with your doctor, right? It's healthcare, it's fast paced. Fortunately, in vision rehab, we can still take 45 minutes, an hour sometimes with our patients, because it's really more trying to figure out functional things. But I would say it's never too early to visit with a vision rehabilitation doctor to know what your options are. But the moment you are starting to have any kind of functional problems, that is when you want to speak up for yourself and make sure you get connected to people that can help you.
Thank you. And I'm just going to do a couple more questions. So lots of people, lots of professionals work with computers all day long, or even, phones, smartphones and tablets. What can they do to, well, I did mention, if you were listening at the beginning, Healthy Vision Month, you got to do the 20-20-20 rule, which helps everyone. But, I want to hear from the glaucoma patients. What do you do to help rest your eyes or improve your computer use during the day? Or Amanda, you do detailed work, which is also strenuous on the eyes. What do you recommend for everyone?
Well, I take lots of breaks because I can tell when I'm getting kind of overwhelmed. And then I have a little visor that I use when we're doing really detailed jewelry work that helps a lot. It has magnifiers in it, and it's over the counter. I just got it on Amazon, and it's great. And I have a huge computer screen and I use the zoom in a lot, especially when we're working on like digital designs, and that helps. But I think just knowing when to take breaks, you can kind of I can just kind of feel like, okay, like I'm getting overwhelmed or, whatever. And then taking a break, stepping away, going outside, getting a fresh breath of air. And that always helps me a lot.
Thank you, Amanda. Richie, you want to go next?
Yeah, I think those were great tips. Only a couple that I would add. Number one, I'm an Apple Mac guy, both for my phone and my computer. There's some fantastic accessibility technology built in. Actually, just learned a new tip on Monday, Michelle, for the iPhone. You don't have to have your screen reader on all the time, which quite honestly was challenging for me. But if you turn on the setting called Speak Screen, when your eyes do need a rest, you simply hold down on the message. And whether it's an email or a website or a text, it will be read to you. And when it's done, the functionality is turned off again. So it's a good break from having to read.
Thank you. Shauna, do you have anything to add?
And also my meeting times, I spread them out so that you have that time span between your meetings. Because a lot of times, sometimes I have meetings, so I'll spread those meeting times out. So you, as Amanda says, you have that time to relax a minute, take that downtime, and then go back to your next meeting or project.
And we'll take one last question, which is, yes.
Could I just add, we all have to take drops when you have glaucoma, right? Mm-hmm. You have to take a lot of drops. And unfortunately, the drops sometimes can have some irritation effects. So part of the problem when we're looking at screens is our blink rates go down. And that's part of that 20-20-20 rule, to really take a very forceful blink, take a break. But to help extend your time on the computer screen, using lubrication drops, preservative-free, artificial tears or lubrication drops can make people more comfortable while they're doing their screen time.
Thank you.
Dr. Marchensky, a question, and I mentioned this to Michelle. sometimes I lose a lot of my drops, missing. What do you suggest for that? Because by the time the month has finished, I'm out of the drops because I lose a lot of the drops. What are your suggestions for that?
That is like the $1,000,000 question. Unfortunately, most of you are probably on a prostaglandin, which is the teeniest, tiniest little bottle of drops, and they really give you enough drops to last a month. Honestly, like Miss Lewis, you are like probably the most experienced drop taker. And if you're still losing drops, that speaks for everyone on this call. Sometimes your doctor might have samples, although companies are not nearly as good at that. Sometimes insurances will supply an extra bottle every couple months, but there's honestly not a great solution. Something we might try in the office if it's a chronic problem is just trying to teach people to take the drops efficiently, or maybe put the drops in the refrigerator so that when you are putting them in, it feels cold, so you know you hit your eye and not do extra drops. But that is a very good question that I don't have a great answer to, because it's just a challenging, with our healthcare, challenging to get additional medications.
I will add one small thing. It doesn't help if you've lost the bottle, but there are some applicators that you can add to the top of your bottle, such as nano dropper, and those just diminish the size of the drop going into your eye, so you're more using your medication more efficiently. It doesn't help also if you're having trouble and can't land the drop in your eye, that you could help. I'm not sure of the names, but there are some applicators where you can just lean on it while you're putting the drop in your eye. That is something to help as well. But if you've lost the bottle, that's not something that's as helpful. Okay, we are over time, so I will now close it out for us today. But this has been super helpful, so much information for everyone. Thank you, Tracy, Amanda, Charnette, and Richie, for joining us today. You've done an amazing, amazing job. Thank you so much. And thank you to our participants who joined us today, and for your interest and your constant support. If you were unable to get your question answered today, please visit our website. It's our new website, www.glaucoma.org, or any of our social media platforms. And you can find the latest information about glaucoma and our research. Once again, thank you, Aerie Pharmaceuticals, for your sponsorship. And thank you, all of you, for your attention today, as well as your interest in Glaucoma Research Foundation. Because of you, the cure is truly in sight. See you next time.